Let's bring in Dr. John Brownstein, an epidemiologist at Boston Children's Hospital. Doctor, thanks so much for joining us. First, just break this down for us. What do we know about this variant, and what do we not know just yet?
Yeah, good evening, Lindsay. I think we have to remember we know far less than we actually know about this variant. Unfortunately, it is very early days, and so we have to be very careful in not necessarily, pressing the full alarm button when it comes to this variant. We're looking at transmissibility, whether this Omicron variant is more transmissible than Delta. Likely it potentially is because we've seen this rapid increase in South Africa, but it's still early days. Also on severity, there were initial signs that hospitalizations were going up, but then we saw anecdotal reports of mild illness. More studies need to be done to fully understand whether this variant is more severe. And then finally, looking at whether these vaccines will hold up well. We fully expect that we will have some protection against Omicron from the vaccines, but we just don't know the full extent. We know that there's a number of mutations on the spike protein that make it concerning, but we just have to wait and see. There's just a lot of open questions, and hopefully the science is going to play out over the coming days and weeks.
What's the most common question that you've gotten from some of your patients about this new variant?
I think the big question that I'm getting from everyone right now is, are we just starting over? Are we heading into lockdowns again? Are we back to square one? And I really believe that we will not be back to that March 2020 when we saw lockdowns. We have so much more now. We have therapeutics, we have testing, we've got a vaccine, and we of course have even natural immunity because this, other variants have spread through this country very quickly. So the vaccines may take a hit, but I don't think we're going to see the lockdowns that we've seen in the past. There is an urgency around vaccinations and boosters, and I think this should be a signal to many people that if you've not gotten your vaccine, get it. If you're eligible for a booster, probably now is the time.
In your estimation, until we have a complete picture of just how dangerous it may or may not be, what should Americans be doing at this point?
Well, it's nothing really, changes. It's just that Omicron raises the stakes. It's what we've already been doing: vaccinations, boosters, mask wearing, testing, ventilation. These are all the kinds of things that we've been doing all along. And of course, we have Delta and really a lot of transmission in the community already. So the addition of this new variant doesn't really change the equation as far as what we would want to do. Testing is really important right now. If you're sick or you've been exposed or you've been traveling, that will help us potentially identify Omicron in communities. I think likely it's already here in this country. Time will tell. We'll find out in the coming days. But people just have to, be sort of flexible. There is a potential that we will see another surge, and people just have to recognize that we may have to deal with additional restrictions. But I don't think we'll get to where we were before. And of course, people just need to follow the science, and things will be much clearer in the coming weeks.
And despite the variant, South Africa is still seeing far fewer cases than the U.S. is seeing per capita. Could this just have been a few super spreader events and South Africa's state-of-the-art sequencing catching it?
Well, I think a couple of things here. I think, yes, South Africa should be really praised for their amazing surveillance that they're doing. They have incredible capacity because they've done incredible work in HIV surveillance, and they're applying it here. And I think they should be praised. I think we created this false, correlation between good detection and incidence of this variant. We just don't fully know where this is around the world. We just happen to know that South Africa has really good surveillance. That being said, we are seeing increases in cases. It's the potential beginnings of a fourth wave in South Africa, so that is concerning. But if you look at the US, we are still in the middle of really significant transmission. So it's easy to look at other countries and see this increase, but we still have a lot of work to do to control this virus here, even in the US.
And lastly, same question to you that I put to Dr. Besser last hour. At this point, do we just need to be resigned to the fact that we will not end this pandemic, but instead it will become an endemic, something that we just have to learn to live with?
I think we absolutely have to recognize that we're never going to eradicate COVID. It's here to stay. But the question is, what are we going to do? We have these amazing vaccines. We can get enough of the population immunized so that it turns into an endemic disease without causing the sort of devastation of hospitalizations and deaths. And that's really what we're trying to avoid. We have 80 million eligible people in the US that have yet to receive their first dose of this vaccine. And so it's either going to be through natural infection or through the vaccine. And I really hope we get to that endemic phase without the levels of deaths that we've seen in the past. So that's a big question on us right now. But yes, we're going to have to rewire our brains. COVID is unfortunately not going anywhere.
Dr. Brownstein, we thank you so much for your time. I appreciate it.
Thank you.
Hi. Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.